you. Congratulations to Charity Village on your anniversary. You certainly have made a difference for many of us creating this really expansive community. So congratulations on your great work, and thank you for hosting and inviting us today. I wanted to say at Volunteer Canada, I have the pleasure of working with a great leadership team and a community of local volunteer centers and associations from around the country. So a lot of what we'll be presenting today really comes from the great work, innovation, and brilliance from around the country. I'm also joined by my colleague, Deborah Pike, who's the manager of our COVID-19 response at Volunteer Canada, and is going to join me on the presentation and serve as a resource for us. So with that, I will get started. So I'll begin with some input from the field. What did we hear early on and what have we continued to hear? And then go into some themes that were common themes among many of our stakeholders. So that would be virtual volunteering safely and screening, virtual volunteering, how to keep volunteers engaged, some governance issues, and then looking at where do we go from here. And with that final comment, where do we go from here? One of the things we were reflecting on over the last few days in comparing this pandemic to other emergencies that we've all dealt with. And one of the things that we're having difficulty with is identifying the phases and the stages, and that is because unlike a flood or a fire where there's an event, and even if it's a protracted event, there's a beginning and end to that event, and then you respond immediately, and then you move into recovery. I think many of us find ourselves in an unknown situation with an unknown timeline, not knowing whether what we're entering into is a reprieve, waiting for a second wave, or whether we're establishing a new way of being in order to wait for a vaccine, and also not fully knowing what we're going back to, if we're going back or going forward. So there's a lot that is unknown, and the benefit we have, of course, is being here as a community together. So many of you do know Volunteer Canada's role. We are a national organization founded by local volunteer centers, and as I mentioned, we work with 200 local volunteer centers around the country, in addition to provincial associations in Quebec, Ontario, Alberta, and British Columbia, where there are many volunteer centers in those provinces. So I'll begin with some input from the field. Early on, we connected with stakeholders. We met with the local volunteer centers. We met with members of the Corporate Community Engagement Council, leading businesses that have leading community investment programs. We also met with general members, nonprofits from around the country that also included public agencies, government department, and educational institutions. And we connected with our colleagues around the world who had actually been dealing with the pandemic earlier on than we had, to learn from their experiences. And so early on, what we were hearing from folks was the need to make that immediate decision. So based on what's going on, based on the risks, based on the level of vulnerability of clients and their needs, what do we do? Do we suspend, postpone, or cancel events, services, and activities, or are there increased needs among those vulnerable populations that we're serving that have increased as a result of the pandemic? So are we needing to increase the types of services or expand the number of people we're serving? And thirdly, how do you adapt? Is it a matter of looking at what was an in-person volunteer role or activity, such as friendly visiting, tutoring, mentoring, and moving that to a virtual format? Or are there services that still need to be delivered in person, where you look at modifying by creating enhanced protective measures, lower touch formats? So that was the initial phase that I think many of you could relate to. And of course, this changed over time. When people thought this would be a matter of a few weeks, they may have made one decision. As we all realized that this was going to be a longer term situation, I think that things changed. So for example, initially an organization may have decided to continue a service, not to engage volunteers, to have staff only deliver the service, but after a week or so that became unsustainable. Other examples may be the possibility of not having certain courses or support services for a week or two, but again, that wasn't sustainable, so the need to look at adapting. So as I mentioned a few minutes ago, not only did that change in the first few weeks, but it's changing again. And we'll talk more about that and hear more about that from you. So at this point, we're interested in hearing from you in terms of your own experiences. So since the pandemic was declared in mid-March, has your main program or service been suspended, postponed, or canceled, increased or expanded, continued by transitioning to virtual, or continued by modifying? What was your experience? And so I know that the poll is open.
Wonderful. Yes, I've got it open on the screen, Paula, and so you can just go ahead and vote right on your screen. I'll just leave it open there for a few more seconds so we give everyone here a chance to have their say. Great. Okay.
Excellent. So as you're answering and we're getting a sense of what your reality has been, I also want to say that we definitely welcome questions as we go along.
Wonderful. Okay, so I've just shared the poll results on the screen here so everyone can take a look. So it looks like we're seeing 46% have been suspended, postponed, or canceled. 3% have increased or expanded. 39% continued by transitioning to virtual, and 11% continued by modifying to lower touch or increased safety.
Oh, great, interesting. And so in terms of the number of organizations that have had to increase or expand, I think those are in the area of home support and services to older adults and other vulnerable populations. And so we'll touch on that a little bit later, but it's interesting to know what the experience and your realities are in terms of this presentation. Okay, so we will look at volunteering safely. That was the first issue that came up for many folks. What do you do when you want to consider the needs of your community and the people you serve, and of course the safety of all those volunteers, staff, and those that you provide service for? So as always, the ultimate authority is the public health authority in your jurisdiction. So that is always a continual updating that we all receive. Determining whether it is safe for you to volunteer. So this is from a volunteer's point of view, that it's really one of those things that's so difficult for someone who is caring and compassionate and driven to help others. I know that it has been very difficult for volunteers to realize that it is safer and it actually is providing a service and helping others by keeping themselves safe, which keeps others safe. But determining whether it is safe to volunteer in person based on your own level of vulnerability. Many volunteers were a little bit shy at first to ask the organization what practices were in place, and then that became a more comfortable conversation as the days and weeks went on. But that's definitely important. And then, of course, deciding whether you're comfortable with those practices, and if not, thinking about whether a virtual volunteer opportunity is a better option. So that seems to be the process that volunteers have been going through and that we've promoted at Volunteer Canada. And I know that most organizations have been encouraging volunteers and those considering to volunteer to look at that. One of the things that's often discussed at the table when we have nonprofit organizations together and others when we talk about volunteers, the question is, are volunteers considered to be employees? And that's always an important question to ask, but it was particularly important to revisit that during this public health situation. So as many of you know who've participated in other webinars around screening that we've done and looking into this yourselves in your own provinces and territories, there is no consistent piece of legislation that declares whether a volunteer is considered to be an employee under the law. However, it is implied and sometimes actually articulated in certain pieces of legislation. But nevertheless, it's always important to consider volunteers as employees when you carry out practices. And the reason being that no matter what, organizations are responsible for anything done in their name. So whether it's a paid employee, a student on placement, or a volunteer, an organization is responsible for what they do, and anything that's done well, harm that may come to somebody as a result, the organization is ultimately responsible. And in addition to that, the organization is responsible for providing a safe, fair, harassment-free environment to all those they engage, whether they're paid employees, students on placement, or volunteers. So for that reason, we always suggest that, with the exception of compensation and issues of recognition, that basically most policies and practices that have to do with human resources broadly need to include volunteers. And here are some considerations for screening. So again, starting with the direction of Public Health Authority, looking at whether your programs and services have been deemed essential, what is known about the vulnerability of the population that you serve, and how that relates to all those you engage, additional risks in this particular situation, and then determining what the best screening practices are for not only safety, but improving matches, increasing the quality of your service, and of course, safety and mitigating risks. So here we have another poll, and one of the things that we have heard is that screening is challenging in this situation, mostly because many of the things that we do, we have information sessions in person, we have interviews in person, we may do our training and our orientation in person. Most of the steps, the 10 steps of screening, have to do with some in person, and as well have to do with other people being available. So those that you call for references being available and working. And in this situation, we find ourselves having to adapt. So the question is, looking at these first 5 steps of screening, which have had to change as a result of the pandemic.
That's great, Paula. So again, you can just vote on your screen. I know I heard from a few folks on the last poll that it wasn't allowing you to vote on the screen. So feel free to type your answers in the chat box as well if the polling is giving you any trouble. Great. Okay, so I'm going to close and share this poll so everyone can see the results. So we've got pretty even distribution, 51% assessment, 66% assignment role position, 35% application, 59% recruitment, 67% interviews.
Mm-hmm.
And Paula, do you want me to launch the second part of that poll while we're discussing
sure,
that?
that would be great. So the other 5 steps, that would be fantastic.
Great. So here's a few more. You can go ahead and, again, vote on the screen or put your answers in the chat box.
And I know that in addition to how we've had to adapt some of these steps, there's also how have we collaborated with others that are either similar organizations or serving similar populations. We've really noticed such an incredible amount of collaboration and checking in with one another because of this new situation that many of us find ourselves in, and sharing new practices and how we're innovating. So I think this is one area where there's been a lot of innovation, but there was a lot of initial angst about how do we go about screening to make sure that we're upholding our duty of care, to make sure that the volunteering is safe and of quality for both volunteers and their experience, as well as those that they're helping.
And on that note, Paula, it looks like we've got 19% are indicating reference checks have been impacted, 38% police checks, 88% orientation and training, so that's the big one there, and 69% supervision and support, and then 40% feedback and evaluation.
Thank you. And some of you may be already connected to volunteer centers and other associations, but many of those have been really innovative in offering resources to help and support those steps, including some generic types of training on topics that are relevant to many volunteer roles, and other kinds of resources. So that's also been incredible to see. So now we're on the topic of virtual volunteering. Over to you, Deb.
Thanks, Paula. Hello, everybody. One of the adaptations that we've been hearing about and you've been seeing on your screen for organizations, especially during this time, is around virtual volunteering. We've been hearing a lot about that. And while the concept of virtual volunteering, which is volunteering done online, usually off-site, from the organization rather than in person, the concept is not new. There are many organizations who have existing virtual volunteering opportunities as part of the way that they engage volunteers. For many organizations during this time of pandemic, it is absolutely a new way and a new approach for engaging volunteers. For many volunteers, it is a new way to connect to volunteering opportunities or continue their volunteering while many of us have to stay at home. So we have been hearing from organizations in the field, and you've seen from some of the polling that we've done, that organizations have told us that they do, in fact, have virtual volunteering opportunities. Some of them do have those, and they've been promoting those as part of their repertoire even more during this pandemic. Some organizations are moving their in-person volunteering opportunities where possible to virtual opportunities. Some organizations have begun to develop new virtual volunteering opportunities to be able to expand the number of volunteers that they engage in and ways that they can deliver their programs. And for some organizations, it's just not possible. Their volunteer opportunities are not suitable for volunteering. We saw on the poll that we just recently did, that you guys just did on there, that there's 39% of you have said that you are looking to move to virtual volunteering opportunities. Imagine Canada has just released a report, and the results in that report would echo what you are saying. What they have found was that 54% of charities surveyed have transitioned from in-person programs to online opportunities. And that same number of organizations are putting greater emphasis on their existing online programs. Of course, we know that there are adaptations that are needed for organizations to be able to transition to or develop new volunteer opportunities that are virtual. And we have some new information and training related to that for organizations who are looking for some of that information. We've been working with Volunteer Toronto on their new training series, which is called Managing Volunteers During COVID-19. And you will be able to find 5 30-minute modules that cover all areas of the volunteer management cycle, and looking to adapt those areas for COVID-19 programming. So those modules include information on program and role planning, position descriptions and recruitment. There's information on adaptations for screening and risk assessment, for orientation, training and support, which seems to have been a big area where folks are looking for having issues and training, looking for training on those areas, and then again on recognition and retention. So we're trying to make it easy at Volunteer Canada for organizations and volunteers to be able to find virtual volunteering opportunities. So we'll flip to our resource pages at the end of the session, but we did want to let you know that we are posting virtual volunteering opportunities on our website. And there are links there of volunteer centers across the country who are posting opportunities on their platforms. Back over to you, Paula.
Thanks, Deb. Are there any questions or great examples? So I think that one of the things I love about Charity Village webinars is it's not only receiving information, but it's people sharing with one another. So if anyone has some great examples that they want to share, either with each other here or with us at Volunteer Canada, that would be fantastic. So one of the things that, should I pause here just to see if there are any questions that we want to answer before moving on?
Sure, Paula. I think one thing that we can address just quickly, because a lot of folks are asking about it, is we'll have links to all of the resources that are being mentioned today in one of the slides towards the end of the slide deck, I believe, Paula. Is that correct? Absolutely. And as Deb mentioned, Deb will give us an overview of our resource page that curates great resources from around the country, as well as those that we've created ourselves. So yes. Excellent.
Yeah.
Thank you.
And all the resources that are referenced at the bottom of the pages are also found on our resource page.
Excellent. I put the resource page link in the chat box as well in case people want to check that out. And of course, you will get a PDF of the slide deck with the recording, so you'll have access to all the hyperlinks quickly and easily as well. Great. Thanks, Paula.
Okay. One of the things some of you may have experienced is for those volunteers that are staying home, either because they are vulnerable or because your programs and services have been postponed or canceled for the moment, one of the challenges can be social isolation of those volunteers, particularly when we're talking about older adults, but not only older adults. Those for whom volunteering has been a really important connection to community, a really important way to be with others that share their values, that this can be a very difficult time, particularly when it feels so bad not being able to help when that comes naturally to you. And so organizations are really taking that seriously, making sure to check in and finding innovative ways to connect and stay engaged with volunteers, not only to keep them engaged so that they can come back and volunteer after, but because there's a relationship there and there's a feeling of responsibility for the well-being of volunteers who are now social isolating. So that's an aspect I think that came to us, and many organizations, as I said, have responded so wonderfully in terms of their responsibility to volunteers. And here you have some great examples. When it comes to governance, we had many questions from members of boards and from those that are trying to work with their boards around some of the decisions. And as many of you know, there are so many implications, not only in service delivery, not only in our practices, but in the well-being and resiliency of our organizations. So these are some questions that we collected from those conversations. The first is, of course, can we continue to offer programs and services according to public health? And again, that changes over time. And if you continue, how do you modify service delivery and mitigate risks? In terms of canceling and postponing programs, again, there are implications, including financial implications. If it's a program, service, or activity that was fee for service, or particularly a large fundraiser, then there are financial implications. And the other thing that has been very satisfying for many organizations is when funders have been in touch with them, or they've been in touch with funders, to get a sense of their flexibility regarding funds for projects. In many cases, funders have said, take a portion of those funds and reallocate them to your response right now, or to unrestricted, and that's been very much appreciated. In other cases, it's a matter of agreement to postpone some of the activities, but it's really important for the board to know that those conversations are happening and that the adaptations that are being made to funded programs are acceptable to funders and regulators. Of course, there's also what the impact of these things are on employees and the ability of the organization to retain paid employees. So those are some of the things that boards have been dealing with. Most boards have also had conversations about how to be supportive of employees, how to look after the well-being of employees as the stress for everybody, particularly those dealing with an increased workload, a more intense workload, and the natural anxieties that come with this situation. In terms of being able to work from home, and again, this isn't new, we're a few months in, but these were some of the conversations, the resources needed for employees to work at home. When it's only a week or two, it's one thing, but when it's longer term, many organizations are compensating employees for upgraded internet services, printers, other kinds of equipment or expenses that come with working from home. Looking at the vulnerability of the organization, short-term and long-term, looking at scenarios, preventing them from occurring if possible, or being prepared in some way. And also looking at questions that you may be asked to deal with in terms of media or general public. And looking at how you ensure to continue to meet your obligations and exercise your duty of care. So what is our ultimate responsibility, again, to those that we engage, whether we're talking about employees, clients, members, participants, volunteers? How do we continue to do that? There was a great blog written by my colleagues on this, and there's a link to that as well. I'm going to pause for a moment, see if there are any questions before we look at the future.
Yes, Paula, here's a great question, and you may address this later in the presentation, but how are organizations dealing with volunteers who might be in some of the more vulnerable groups related to the pandemic? Are you finding that they're primarily restricting who can volunteer right now just to protect people?
Most organizations in a jurisdiction where there has been a directive related to a specific age, they are following that. So if you are in a jurisdiction where it has been directed that anybody over the age of 70, for example, stay at home, then organizations are respecting that. When there are issues related to increased risk, for other populations, again, organizations are being proactive in asking volunteers to indicate what their comfort level and to self-identify. So I think it's happening in those ways. When it comes to services that are home support, you know, particularly services to older adults, many of those people who volunteer in those activities are older adults themselves, and that has been one of the biggest challenges. Our estimates right now are that about 20% of volunteer hours are contributed by older adults, and but many of those volunteer hours are directed towards home support and some of the services to vulnerable people. So that has been the biggest challenge in this situation for sure.
Yeah, that's helpful. So we had a few questions about that, Paula. And just in terms of engagement, I wanted to read out a comment from Carla, who suggests that taking time to connect with volunteers by calling them can be a great engagement strategy. It takes time and great listening skills, but it's well worth it.
Absolutely.
Wonderful. Okay, I think we can carry on, Paula. Thank you.
Okay. So at the beginning, I was reflecting on the challenge of really being able to identify what whether we're moving into recovery from response, whether we're moving into recovery at the same time as we're undergoing response, and whether it's a reprieve until another wave or a new way of being as we wait for a vaccination to be available. And I think that every organization is looking at that differently, but again, we're in such a large country that these things are also nuanced and different circumstances in every region. So this is something that I think we're going to take a while to figure out, and that this is also going to be something that's changing. So again, key questions: can we resume activities, programs, and services that were canceled? Every program and service is different. Is it essential? Can it be done differently? How can you put measures in place to reduce risks? And how are you viewing it? So those are the kinds of questions that we're seeing and that we're part of. And I'll just move there. Another interesting thing that I think many people have said is that we've learned some things in terms of service delivery that we may want to retain. That even if, in terms of public health direction, we're able to go back to the way we were, even if that were possible, do we want to? Are there things that we have learned that we want to keep doing in a different way? And looking at the longer term human and financial resource requirements of these realities, maybe for the next year or two, what is different, but what has this meant for our resiliency and vibrancy as an organization? If you have had to close programs or have older adult volunteers stay at home, what does this mean in terms of re-engagement or retaining those connections? What does this mean for the way and the traditional ways you've gone about recruiting people and having people involved in supporting your program? And again, what is the position of your funders? What are their expectations? And are you comfortable with what's being expected of you? And what kind of modifications do you need to make? And again, are funders and regulators supportive of that? So there's some similar questions to the first few weeks, but in this case, we're looking at thinking ahead, thinking about what might be longer term strategies or medium-term strategies that we need to put in place until something significant changes. Knowing that we may have to revert back to what we've been doing the last few weeks at any time. And I think that pending unknown is what's creating some difficulties. So here's another poll related to that. Wondering where you are in your process. Are you thinking about next steps? Are you actively planning? Do you have a plan in place?
That's great, Paula, because we've actually had some questions about whether or not there are any published recommendations or templates for sort of moving into the next phases of reopening. I know there probably aren't too many established templates since we're all kind of learning as we go with this pandemic, but I think this will be a good jumping off point for discussion on that.
Mm-hmm. So there are a few organizations that we've been in touch with that we could ask if they're willing to share their plans. And maybe some of you have plans that you're willing to share as well. One of the things that we're very cautious about, and that we were cautioned in terms of templates, that every organization is different. Every jurisdiction is so different in provinces and territories that it's very difficult to have a plan that would carry out your duty of care to the standard of care that's expected in your own sector, in your own jurisdiction. And so we, even though there's, it's wonderful to be in a position where we can share, that we always want to caution people that sharing stories and experiences helps, but go back to your own situation, get legal advice, make sure your board is informed about what your unique responsibilities are.
Well, that's excellent. Excellent advice, Paula. I've just shared the results here on the screen. So we have 39% are thinking about next steps, 51% are actively planning next steps, and 10% do have a plan in place for the next phase of operation.
Okay, I think that's somewhat consistent with some of the things we've been hearing elsewhere. And in a week, that's going to change. I did want to talk about sector advocacy broader than the volunteer engagement lens. And many of you have heard within your provinces and territories and national organizations efforts to advocate for the circumstances in the nonprofit sector. So you may remember early on when wage subsidies and loans were available to the private sector, that shortly thereafter it was extended to the nonprofit sector as well, recognizing that our entities are also employers and are also corporations that have expenses. And so that was really a great success in terms of the advocacy that was done. You also have heard of other discrete things in provinces and territories looking at beyond that. So as mentioned earlier, some of the financial implications of the pandemic have meant that those activities that are fee for service, those fundraisers that have been canceled have had huge implications for many organizations. And so there are leadership organizations looking for resiliency funds. And I wanted to point out, so I know in various provinces and territories that is happening, and great work. In addition to that, at the national level, Imagine Canada and some other leadership national organizations have come together to promote a campaign for that. So there's an information sheet that we could send to you, and the link is there, that gives you a sense of how you can get involved, how you can connect with your local MP or get involved in your provincial initiative. Et voila. So back to you, Deb.
Thanks. So as you've been seeing throughout the presentation, we've included links to various resources, and Marina said that she will share those links out afterwards. I would also direct you to our resource page on the Volunteer Canada website. One of the things that has been overwhelming during this pandemic is, where can I find relevant information? And there's a lot of information coming at us in every different direction. And we thought it would be useful to be able to curate those resources and put them in one place for organizations to find. Note that all of the resources that we've put onto our page are specifically related to volunteer engagement. Organizations with broader mandates will have information on different aspects of the nonprofit sector. So we thought we'll make sure that the information that we share is around volunteer engagement. So you can find the COVID-19 and volunteer involving organizations resource page on our webpage. We have segregated those resources into different categories to make them easier to find based on the information and the requests that we're getting from organizations in the field. There is a section there on virtual volunteering, which will link to a page on our website, which gives you some general information on what is virtual volunteering, and then links to some of the volunteer centers that are hosting volunteering opportunities that are virtual. Volunteering safely information is also a tab there, and there you can find a fact sheet on considerations, health and safety considerations for volunteering during COVID-19, and some other information on volunteering safely. The information on volunteer management and emergency response, specifically related to this time of COVID-19. As Paula mentioned, there's lots of information on sector advocacy. Governance and operations is one area, and in particularly, we've been asked for information on how to operate your annual general meetings during this time. So what we've done is curate some of the information that we've found from various provinces on that topic and segregated those out. You'll also find some resources on corporate community engagement. The public health links are always there and updated. And in addition, we've included a tab on online learning for any upcoming webinars that are relevant to volunteer engagement. And then because we don't have time to be listening, none of us has time to be listening to every webinar, we have the recordings from previous webinars also available as links on that site. The other two pieces that we link to on the website are information on how to find the COVID-19 directly related volunteering opportunities and virtual volunteering opportunities. So we have separate tabs that we're linking to from various pages on our site, including this one, and those will directly link you again to lists of volunteer centers who are offering particularly COVID-19 volunteering opportunities and then virtual volunteering opportunities. You may note that I'm always saying that we're linking to lists of volunteer centers. And there's a reason for that. We work with, as Paula said, a network of more than 200 volunteer centers across the country, and all of those are working with individual organizations in their communities. And we have confidence that those volunteer centers are vetting the opportunities that their organizations are posting, and they know the organizations in their communities. So that's why we've chosen to list and connect with volunteer centers around those opportunities. Those are being updated on a regular basis, so please feel free to check back to see which centers are posting opportunities. Note that some of those centers that are listed there and the platforms that are listed there have broader than just local community reach. For example, the Je Bénévole site in Quebec will cover organizations across the province. So right now, I think we have almost 30 centers or platforms that are listed under the COVID-19 volunteering opportunities, and about 15 or 20 who are listed under the virtual volunteering opportunities. Those are changing, as Paula said, all the time, week over week. Organizations are being able to offer more opportunities, and we will list them as we have them. Again, go to this page for all of the resources that were listed at the bottom of the pages in the presentation today. And don't forget also, we mentioned that for those of you who are looking for specific training on the adaptations to the volunteer management cycle during COVID-19, that on Volunteer Toronto's site, you can find those 5 modules. Each 30 minutes that will walk you through some of those adaptations in each of those different areas. That's it. Back to you, Paula.
Thank you, Deb. Thank you, and thank you for your leadership managing our COVID-19 response. It's been great, and as you keep hearing us say, links to other people's resources. One of the things that is really has been awe-inspiring is the work and the innovation in the sector and among volunteer centers. I think that it is one of those things that is not well known, and when everybody rises to the occasion in times like these, we really get to see it. So it's quite outstanding. One of the other issues that many of you have been aware of is when a call goes out for people to volunteer and there's this surge of compassion and people wanting to step forward and volunteer, it can also be frustrating when they're not able to find or hear back from organizations. And this is somewhat similar to what we experienced, for example, when we were welcoming Syrian refugees, or at times when a community has been hosting an international event. And it is heartbreaking to think that someone might be discouraged or feel rejected when they're trying to volunteer. And we're really trying our best to help people understand what the process is for nonprofit organizations having the capacity to deal with huge volumes of people approaching them, to find roles, to undertake the necessary screening and so on. So I think that all of you have experienced it from one side or another, that dilemma where there's definitely still a need, and it's definitely taking time for us to be able to effectively, collectively as a sector, connect the generosity with the needs. Does that resonate with anybody? And are there other questions people have that we haven't answered? I know that there was an interest before the webinar in addressing the issue of older adults and baby boomer volunteers. We did look at that earlier, but if that wasn't all the information you were looking for, please let us know.
That's great, Paula. While we're on this resource page, I did just want to bring forward a question that's come up about the Volunteer Toronto modules that you mentioned. Quite a few folks are interested in that. Are those links available on this page?
They aren't available yet on this page as they're just new and up, but I will send that link to Marina and make sure that you can share it back out with the other resources.
Wonderful. No, that's great. So we can make sure that that gets included in the follow-up email that we'll send to everyone. And I've also just put in the chat box the link as well to the Volunteer Toronto COVID resource page in case anyone's interested in that also. And I think you'll find in other areas of the country, your local volunteer centers likely have their own pages as well. So definitely check that out. Paula, did you want to carry on and close off and then we'll jump into questions?
I think we're ready for questions. I think there's been a lot of innovation. There's been a lot of compassion. And I think that the fact that so many are willing to come to these types of webinars and share and work this out together is really outstanding.
Mm-hmm. Okay, so I've seen a large amount of comments from folks in Ontario who are saying they are very much struggling with being able to obtain vulnerable police checks. Have you heard that, and are there any updates on that?
Yes, so as many of you know, every jurisdiction is different, even within a province, in terms of having a police check or a vulnerable sector check. And one by one, I know the best thing is to approach your local volunteer center to find out what the current state is, but also to see what advocacy that center is doing and what conversations they've had with their police services. There's been some that have put that on hold, others that have restarted those services.
And I would also add, in terms of specifically, since it's an Ontario question and there may be some organizations on from Toronto, in the module on screening and risk in Volunteer Toronto's modules, there is a download in there that will give you some specific information around related to Toronto Police Services. So if you go to those modules, you'll be able to find information on how what the direction is from Toronto Police Services. But to echo Paula's point, this information is changing weekly. So we know that every police service is different, but do make sure that you check in with your police service to find out what the process is. Some of them are able to move online, but again, we are told this is changing over time. So please check with your individual police services for the most up-to-date information.
Mm-hmm. Another question that's come up from several folks, and I'm wondering what you both are hearing from other organizations, and this is around concerns about liability for volunteers as we move into phased reopening. If volunteers come back and they get sick, what that means for an organization.
That's a really great question, and I think that we do need to take that seriously. That's one thing where organizations, there is a volunteering safely consideration info sheet that we have under volunteering safely that walks you through the different considerations. Having said that, you also, in many cases, need your board to look at your insurance policy and consult a lawyer in terms of those kinds of elements. But the bottom line is always wanting to do as much as you can, given the practices and the standards of practice in the sector and what's available. So consulting with colleagues in the sector and again, going through that checklist of considerations is a good idea.
Yeah, and we've had in tandem with that some folks asking about whether using waivers is a good idea. And I think with all of that, I think you've brought up a very good point, Paula, of, you know, taking a close look at your insurance policy and getting legal advice where may be needed is probably your best route.
Absolutely. And I think that many of us feel that regardless of what you know, the legal liability may be or the potential, we essentially just always want to be doing the right thing and doing the very best to mitigate risks and to make sure that anyone who does volunteer and decides to do that within the risks needs to be absolutely informed of the risks. And so there are many things that we need to take into account to know that people are making decisions to volunteer with us with all the information that they can available to them.
Mm-hmm. Have you seen any standards being developed on providing PPEs to volunteers by the organization, or are we finding that organizations are relying on volunteers to bring their own protection?
If an organization is engaging volunteers in an activity that requires equipment, the responsibility is the organization's. That's not to say that some organizations may be asking if volunteers do have access to that on their own, but it is the responsibility of the organization to ensure one way or another that any needed equipment is available.
Mm-hmm. Sort of on a similar note as well, and I'm assuming this is covered in the safety portion of your resources, but are there guidelines and messaging to help volunteers understand good safety practices, good hygiene practices as they're volunteering?
Absolutely. One of the resources does speak to that. Again, it's the volunteering, the considerations for volunteering that is available. And Deb, did you want to speak further to that?
Sure. Paula is right. That is the resource that is up there does speak to that. And it's always referencing the public health guidelines around health and safety practices. It does link to all of those sites and includes information of what you should consider, as Paula said, before you decide to volunteer, whether you are well enough to volunteer, and information for when you get to volunteering and after you're volunteering. Those practices are on that sheet that is called Health and Safety Considerations for Volunteering During a Public Health Emergency, and that's found on our website.
That's great.
And one of the things that's really, sorry.
Nope, go ahead, Paula.
One of the things that's really important is that we as, you know, those of us in organizations wanting to engage volunteers, and we may feel very driven to engage people to meet the needs of people we serve, we need to make sure we give the space and make it very comfortable for people to say, I'm not comfortable volunteering right now, I feel I'm vulnerable, rather than feeling the pressure that the organization is feeling to meet the needs of those they serve. And that's a difficult one, but I think it's also one that's very important, that we support volunteers or potential volunteers in making a decision to stay home if they're not comfortable or if they're vulnerable.
I think that's an excellent point, Paula. We certainly don't want to be pressuring people into doing things they're not comfortable with in these times. I think we'll move on to our last question for today, since I see we're coming up on time. You know, we have talked a bit about virtual volunteering, but for organizations that really don't have a lot of virtual opportunities right now, their programs are very much based face-to-face. Do you have any recommendations or things, you know, good practices you've seen to keep volunteers engaged while things are on hold?
Many organizations are looking at this as an opportunity to provide interesting training. So for example, if it's an environmental organization or if it's an organization that may be dealing with a certain social justice issue, this is a great opportunity to provide online training or discussions about the topic related to the mission. So that's one thing. It's both stimulating and enriches that connection between the organization and the volunteer, but also equips the volunteer to be able to expand their role or deepen their relationship with the organization moving forward. There are organizations that are having weekly time, bring your own beverage and just connect, so that socially people are connecting. So those are two things that are happening. Health checks. People are also developing phone trees amongst volunteers, so people are calling each other again with a check-in, but also just to make sure that everyone is connected in some way. The other thing is people may underestimate the types of virtual volunteer opportunities that they have. I'm not suggesting anyone make up work, but there are things that would be very valuable. Wouldn't it be great to know if somebody looked at your website and gave you impressions on things that could be improved? These are things that we don't often have the time to do, but inviting people to do that. Look at our website, give us feedback. Or let us know, these research papers that we have on our site, are they in the format that would be interesting for you? So again, I'm not suggesting we make up things to keep people busy, but there are probably some valuable things. There are policies that could be reviewed. There are help, revising our human resource manuals. There could be people doing research on what's going on in other jurisdictions that relates to the work that organization's doing. Is there a great model out there on how to re-enter the field after 3 months? So there are probably more things than we realize.
I agree, Paula. That's a great place to end things at, I think. Do you or Deb have any final comments before we sign off?
Just simply thank you, and please send any ideas, thoughts, models, resources that you have, because the innovation and the creativity and the dedication folks are exhibiting here is just great, and we feel really privileged to be able to receive that and share it with others. So thank you to all those who have contributed to the knowledge that we have been sharing, because it's all of yours.
Well, thank you so much, Paula and Deb, for a wonderful presentation. We always appreciate having Volunteer Canada here presenting for us and hosting you. So thank you for bringing all of these fantastic resources to our users. We can't thank you enough. I want to just remind everybody that we are following up with you by email later this afternoon. We'll have the webinar recording, the slide deck. You've probably seen on the slide there that there's a discount code for our online courses at Charity Village, including the volunteer engagement course that Paula wrote for us. So we'll include some links for that as well. There will also be a short survey in that email. It takes less than 5 minutes to fill out, and we'll hope that you'll complete that for us. You'll have an opportunity there to let us know if there's other topics you'd like to see covered in a future session, and we'll also be sure to share the feedback with Paula and Deb also. I'd also like to remind you all that at Charity Village, we do have a lot of resources available to you. We do have a dedicated COVID-19 resource page as well. You can find that, the link to that is right on our homepage. Our job postings are currently available at a 15% discount until May 31st. And as we've already mentioned, as webinar participants today, you can use that webinar 20 discount code to take $20 off our online courses, also until May 31st. Additionally, you can visit our site to post free volunteer or event listings, including for virtual events, and browse our thousands of articles, dozens of webinar recordings, or listen to our weekly podcast. On behalf of Charity Village, thank you so much for joining us today. We do host dozens of free webinars every year, and we hope to see you at more of our sessions. Our next one will be held on Thursday, May 28th, and will feature ankle back office solutions discussing how your nonprofit can weather the anticipated economic storm. So we'll include a link to that as well in the email that we send later today in case you'd like to register. Thank you all again for taking part in today's webinar. I hope you have a wonderful rest of your day. Stay well and safe, everyone. Bye-bye.